Liver's cry for help, the alarming progression of fibrosis. Liver fibrosis is a complex process characterized by the excessive accumulation of scar tissue in the liver. It is a progressive condition that can result from various liver diseases and injuries, including viral hepatitis, alcohol abuse, non-alcoholic fatty liver disease, NAFLD, autoimmune liver diseases, and chronic exposure to toxins. This detailed article aims to provide a comprehensive understanding of liver fibrosis, including its causes, pathophysiology, stages, clinical manifestations, diagnosis, and management strategies. Causes and risk factors. Liver fibrosis can arise from a multitude of causes and risk factors. Chronic viral infections such as hepatitis B and C, excessive alcohol consumption, obesity, diabetes, and metabolic syndrome are among the most common triggers. Other factors include autoimmune liver diseases, for example, autoimmune hepatitis, primary biliary cholangitis. Genetic disorders, for example, hemochromatosis, Wilson disease, certain medications, toxins, and long-term exposure to environmental pollutants. Pathophysiology of liver fibrosis. The development of liver fibrosis involves a complex interplay of various cellular and molecular processes. Chronic liver injury triggers inflammation and activation of hepatic stellate cells, leading to their transformation into myofibroblasts. These myofibroblasts are responsible for the excessive production and deposition of extracellular matrix proteins, such as collagen, resulting in scar tissue formation and disruption of normal liver architecture. Stages of liver fibrosis. Liver fibrosis progresses through several stages, ranging from mild fibrosis to advanced cirrhosis. The commonly used staging systems include the Medivir scoring system and the ESHOC fibrosis staging system. These systems classify fibrosis into different stages based on the extent of fibrotic tissue deposition, with higher stages indicating more severe fibrosis and increased risk of complications. Clinical manifestations. In the early stages, liver fibrosis may be asymptomatic, with no obvious signs. As fibrosis progresses, individuals may experience nonspecific symptoms such as fatigue, mild abdominal discomfort, and general malaise. As the disease advances to cirrhosis, symptoms become more pronounced and can include jaundice, abdominal swelling, easy bruising and bleeding, ascites, fluid accumulation in the abdomen, hepatic encephalopathy, brain dysfunction, and portal hypertension-related complications such as varices and hepatic decompensation. Diagnosis of liver fibrosis. Accurate diagnosis and staging of liver fibrosis are crucial for appropriate management. Diagnostic approaches include blood tests to assess liver function, liver imaging techniques such as transient elastography, fibroscan, and magnetic resonance elastography, MRE, to estimate liver stiffness, and liver biopsy, which remains the gold standard for evaluating fibrosis stage and identifying associated liver diseases. Non-invasive alternatives to liver biopsy are being developed, including serologic markers and imaging modalities, to reduce the need for invasive procedures. Management strategies. The primary goal of managing liver fibrosis is to halt or slow down disease progression, prevent complications, and improve overall liver health. Treatment involves addressing the underlying cause of liver injury, such as antiviral therapy for viral hepatitis or lifestyle modifications for NAFLD. Lifestyle changes, including weight loss, exercise, and a healthy diet, are crucial in managing fibrosis related to obesity and metabolic syndrome. In advanced stages, liver transplantation may be necessary for selected patients. Research and future perspectives. Ongoing research efforts aim to better understand the molecular mechanisms underlying liver fibrosis and develop novel therapeutic strategies. This includes investigating antifibrotic agents, immunomodulatory therapies, and interventions targeting specific signaling pathways involved in fibrogenesis. Additionally, advancements in non-invasive techniques for fibrosis assessment and monitoring hold promise for more convenient and accurate disease management. Mechanisms of fibrosis progression. Liver fibrosis is a dynamic process influenced by multiple factors. Chronic liver injury leads to the activation of inflammatory cells and the release of pro-inflammatory cytokines, which promote the activation and proliferation of hepatic stellate cells. These activated cells are the main source of collagen and other extracellular matrix proteins that contribute to scar tissue formation. Additionally, dysregulation of the immune response, oxidative stress, and genetic factors play a role in fibrosis progression. Progression to cirrhosis. Liver fibrosis can progress to cirrhosis, which is characterized by extensive fibrotic scarring and disruption of normal liver structure and function. cirrhosis can lead to complications such as portal hypertension, liver failure, hepatocellular carcinoma, and an increased risk of infection. Regular monitoring and intervention are crucial to detect fibrosis progression and prevent the development of cirrhosis. Risk factors for fibrosis progression. Several factors influence the rate of fibrosis progression in individuals with liver disease. These include the underlying cause of liver injury, such as viral hepatitis or alcohol abuse. Coexisting liver conditions, such as fatty liver disease or autoimmune hepatitis. Age at the time of diagnosis, gender, genetic predisposition, and lifestyle factors, such as obesity and smoking. Identifying and addressing these risk factors can help slow down fibrosis progression. Non-alcoholic fatty liver disease, NAFLD, and fibrosis. NAFLD, a condition characterized by the accumulation of fat in the liver, is closely associated with liver fibrosis. In some individuals with NAFLD, fat deposition leads to inflammation and fibrosis progression, eventually resulting in non-alcoholic steatohepatitis, NASH, and cirrhosis. Lifestyle modifications, including weight loss, exercise, and dietary changes, are key in managing NAFLD and preventing fibrosis development. Role of inflammation and immune response. Inflammation plays a significant role in the development and progression of liver fibrosis. Immune cells, such as macrophages and lymphocytes, infiltrate the liver and release pro-inflammatory mediators that contribute to fibrogenesis. Modulating the immune response through targeted therapies is an area of active research for the treatment of liver fibrosis. Impact of fibrosis regression. While fibrosis is traditionally considered irreversible, recent studies have shown that fibrosis regression is possible, especially in early stages. Treating the underlying cause of liver injury, such as achieving viral suppression in viral hepatitis or implementing lifestyle changes for metabolic conditions, can lead to fibrosis regression and improved liver health. Monitoring fibrosis regression through non-invasive imaging techniques provides valuable insights into treatment efficacy. Liver fibrosis and hepatocellular carcinoma, HCC. Liver fibrosis increases the risk of developing hepatocellular carcinoma, the most common type of primary liver cancer. Advanced fibrosis and cirrhosis significantly elevate the risk of HCC. Regular surveillance for HCC, such as ultrasound and alpha-fetoprotein, AFP, testing, is recommended in individuals with liver fibrosis to facilitate early detection and treatment. Patient education and support. Living with liver fibrosis can be challenging both physically and emotionally. It is crucial for individuals to understand their condition, adhere to treatment plans, and make lifestyle modifications to optimize their liver health. Support groups, patient education programs, and counseling services can provide valuable resources and emotional support for individuals and their families.